All right, today we are going to build a toolkit, an evidence-based one, for managing knee osteoarthritis. And if you're just tired of only thinking about medication, this is absolutely for you. We're going to dig into what really makes a difference, and this is all based on some serious work by leading medical societies. So, you've got knee pain from osteoarthritis, right? And you're probably asking yourself, what actually works besides just taking pills? Look, that frustration is totally real. But the good news? There are clear, proven strategies out there that go way beyond medication and can seriously improve your day-to-day life. And just to be clear, this is not some small niche problem. We're talking about a condition that affects, get this, nearly 600 million people all over the world. That number is just staggering. And it's exactly why figuring out the right way to manage this is so important. Not just for one person, but for public health on a global scale. Okay, so before we can really get into the solutions, we first have to understand just how big of a deal this is. Knee osteoarthritis, or OA as you'll hear it called, it's way more than just a simple ache. Its effects can literally ripple out and touch every part of a person's life. I mean, look at this. Knee OA is a leading cause of disability around the world. The financial cost is huge. We're talking billions. But honestly, the most critical thing to understand is the link to your overall health. Think about it. The disability often makes you less active, right? And that inactivity seriously bumps up the risk of cardiovascular problems. So getting a handle on your knee pain isn't just about your knee. It's about protecting your heart and really your whole life. So where do we even start? How do we build a plan that actually works? Well, a group of French medical societies got together and laid out 5 core principles. You can think of these as the absolute foundation, the non-negotiables that every single good management plan needs to be built on. First up, it's not an either-or situation. The best results, they come from an integrated approach. That means you're combining the non-drug strategies, which is our main focus today, with medication if and when it's needed. And of course, this is all guided by your doctor or physiotherapist. Number 2, there is no one-size-fits-all cookie-cutter plan here. For this to work, it has to be personalized for you. It's got to be a shared decision, a partnership between you and your healthcare provider that really looks at your specific symptoms, your lifestyle, and what you want to achieve. Okay, this third principle is absolutely crucial. A fantastic plan is useless if you don't stick with it, right? And the research is pretty clear. People's commitment, especially to things like home exercise, can really drop off after just a few months. That's exactly why having regular check-ins and getting support is so key for making this work long-term. All right, principle number 4. This is a biggie. Physical activity is not optional. It is fundamental. We're talking about regular adapted exercise. It could be in the water, it could be on land, but it has to be a core part of your plan. And the key here is movement that supports the joint, not movement that punishes it. And finally, principle number 5, knowledge is power. Seriously, understanding what's actually going on with your body and learning how to manage it yourself, that is a game changer. It empowers you to take control, which helps reduce your symptoms and makes it way more likely you'll stick with the whole plan. Okay, so we've got our foundation set with those 5 principles. Now it's time to actually fill up our toolkit. Let's start with the things that have solid evidence behind them, the things that are strongly recommended. These are your do's. So here are the heavy hitters. A physical exercise program, that's a must, always. If you're carrying extra weight, losing even a little bit is a huge deal. Then you have more specific tools, like an unloading brace if the pain is in one part of your knee, using a cane to help you walk better, wearing the right kind of shoes every day, and doing joint mobilization as part of your exercise routine. Let's just zero in on that cornerstone for a second, physical exercise. The goals here are about so much more than just moving. It's about achieving specific things. Yes, relieving pain, for sure, but also building up muscle strength so your muscles can better support your knee. It's about increasing your mobility and, at the end of the day, helping you stay independent. And hey, when we talk about weight loss, don't think you need to make some huge, drastic change. The evidence is super clear on this. If you're overweight, losing just 5% of your body weight can make a massive difference in your pain and your ability to function. That is such an achievable goal, and it's incredibly powerful. Okay, now this is just as important as knowing what to do. We need to talk about what not to do. Let's go through some really common treatments that the evidence says you should probably avoid. This is going to save you time, money, and a whole lot of frustration. Yeah, this list might actually surprise you a bit. Things you see all the time, like that colorful kinesio tape, or electrotherapy,
or even just basic heat and cold packs. They aren't recommended for regular use because there's just not enough strong evidence. Same story for laser and shockwave therapy. And then there's the big one, dietary supplements. Despite all the ads you see, the experts looked at the data and said, nope, we can't recommend a single one. And the language they use in the official recommendations is incredibly blunt. For things like kinesiotaping and those simple knee sleeves, the advice isn't just, they might not work. It's that they must not be proposed as a main treatment. That's about as strong a statement as you can get, and it's based purely on the evidence.
Let's talk shoes for a second, because this is a practical thing you can change today. The advice is super simple. Stay away from flat, flimsy, flexible shoes. What you want are soft, stable shoes that have good arch support and really good shock-absorbing soles. It seems like a small thing, but that one switch can make a huge difference in how you feel all day long. All right, so we've got our core principles. We've got our toolkit of what to do and what to avoid. The last piece of the puzzle is putting it all together into a plan that is built specifically for you. And this brings us right back around to that key idea of personalization. The real power here is in what they call a shared decision-making process. All that means is having a genuine conversation with your doctor or physiotherapist to create a strategy that actually fits into your life and matches what's important to you. So what do you do now? What are the next steps? Well, first, start the conversation with your healthcare provider. Really focus your energy on the big three: physical activity, education, and weight loss, if that's relevant for you. From there, you can talk about which of the other tools from the toolkit, maybe a brace or a cane, could be a good fit. And please remember, this isn't a set it and forget it thing. You have to check in on your plan regularly to make sure it's still doing its job. So there you have it. We've laid out all the evidence, all the principles. The toolkit is officially in your hands now. So the only real question left is, what's the first tool you're going to pick up? What's that first step you're going to take to start building a better path forward for yourself?